Proverbs 17:22. A cheerful heart is good medicine, but a crushed spirit dries up the bones. America is facing a crisis. It's a crisis that affects every single one of us, no matter our age, our background, or where we live. Our healthcare system is on the verge of collapse. In just a few short years, we may not be able to get the medical care we need, when we need it. It may sound dramatic, but the writing is on the wall. The signs are everywhere. Hospitals across the country are shutting their doors, both in rural areas and big cities. Doctors and nurses, burnt out and disillusioned, are leaving the profession in droves. The COVID-19 pandemic put an unbearable strain on our healthcare system. But the truth is, the seeds of this crisis were sown decades ago. Back in 1981, a government-commissioned study warned of a looming doctor surplus. The concern? Too many doctors would drive down wages, making it impossible for them to repay their medical school debts. What followed was a series of decisions that would have dire consequences for the future of American healthcare. This wasn't just a case of short-sightedness. It was a deliberate effort to limit the number of doctors entering the workforce. And now, we're facing the consequences. We're facing a future where getting sick could mean financial ruin, or even worse, losing access to the care we need to survive. Empty hospitals. The consequences of the doctor shortage are being felt across the country, most visibly in the growing number of hospital closures. These closures are not limited to rural or underserved areas. They are happening in cities and suburbs, impacting communities of all sizes and socioeconomic backgrounds. Hospitals, once symbols of hope and healing, are being forced to shut their doors due to financial strain, staff shortages, and a decline in patient admissions. The COVID-19 pandemic only exacerbated these existing problems, pushing many hospitals to the brink of collapse. In 2020 alone, 19 rural hospitals closed their doors, and the trend shows no signs of slowing down. These closures leave entire communities without access to essential healthcare services, forcing residents to travel long distances for even routine medical care. The impact on public health is undeniable, leading to delayed diagnoses, poorer health outcomes, and a decreased life expectancy for those living in these healthcare deserts. The closure of hospitals is a stark reminder of the fragility of our healthcare system and the urgent need for reform. The year 2021 offered a chilling glimpse into the potential future of American healthcare. As the COVID-19 virus raged, overwhelming hospitals and stretching resources thin, a stark reality set in. In several parts of the country, the unthinkable became unavoidable. Crisis standards of care were implemented. This meant that healthcare professionals, facing an unprecedented surge of critically ill patients, were forced to make excruciating decisions about who received life-saving care and who didn't. The traditional model of providing the best possible care to every patient was simply no longer feasible. Imagine a situation where there are more patients needing ventilators than there are ventilators available. Imagine having to choose which patients receive potentially life-saving treatments and which patients are left to confront their fate without the full arsenal of modern medicine. This is the harsh reality of crisis standards of care, a scenario that could become increasingly common if the trajectory of the healthcare crisis continues unchecked. You're going to wonder exactly what you can do to prepare for the upcoming days when it will be harder to access medical care and medical professionals, particularly on an emergency basis. That means I have to understand the basics of caring for myself and my family in a crisis situation. And I have to have a plan for what to do when the healthcare system collapses. So what could I do? John 1:2. Beloved, I pray that all may go well with you, and that you may be in good health, as it goes well with your soul. Remember, taking care of your health is an important aspect of being prepared for any situation, including emergencies. Keeping your body, mind, and spirit healthy can contribute to your overall well-being and readiness to face challenges. Click the link in the description to discover and learn all the life-saving knowledge you and your family will ever need in any crisis situation.